It's really important to me that you understand what's going on in diabetes because that will help you to understand how the medication works. And if you know how the medicine works, you'll be more likely to take the medicine. Okay, so I'm going to break this down slowly in a way that's easy to understand. The main problem in diabetes is that there's way too much sugar in your bloodstream. The extra sugar ends up clogging up your blood vessels like a hairball clogs up a drain. Normally, the way it works is that when you eat food, it gets broken down into sugar and other things, and your body absorbs it all into the bloodstream. From there, the blood vessels take all this good stuff around your body and feed your cells. So let's focus on what happens to the sugar. So the sugar rides around in your blood vessels kind of like a person rides around on a subway. In diabetes, the sugar can't cross out of the blood vessels, so it just sits there. So it would be like if you were riding on a subway and then it comes to your stop and the doors won't open and you can't get out. The reason that your body is not handling sugar right is because the extra fat around your body is telling your blood vessels to not let any more sugar cross into your cells. Basically, your own belly fat is telling the rest of your body, hey, we're good. We've got all the extra energy we need. And this makes sense because fat is nothing but a bunch of stored sugar. So let's go back to the blood vessel. So the sugar just sits there in your blood, and that's not good because it damages the blood vessels. You can think of it like the extra sugar makes everything all sticky and gummed up so that the blood can't flow right. The smallest blood vessels are affected first. Some of the smallest vessels are in your eyes and in your brain and in your heart. Now, if you don't have an eye doctor that you see regularly once a year, let me know and we'll refer you to someone. Another thing that you need to know about is something called diabetic neuropathy. This is just a fancy term to describe the damage that occurs to the small nerves in your feet. People with neuropathy will usually either have numbness or burning in their feet, or you can have a combination of both. There's a couple reasons that I mention this. Number one, if you have this, let me know so that we can start you on the right medication. There's a medicine called gabapentin that really helps with the burning. And you need to be taking over-the-counter vitamin B complex if you have either burning or numbness, because this can really help. The other important key here is that you need to be doing daily foot exams, so looking at the bottom of your foot to make sure that you don't have any little ulcers or infections that are starting that you just simply can't feel. Now, diabetes can also damage the nerves that control how fast food moves through your stomach and your intestines. And this leads to recurrent nausea and acid reflux. And some people will say they get real full after only eating a few bites of food. If this describes you, you need to let me know. This is called diabetic gastroparesis. Now, before you get all panicked that all this is going to happen to you, just know that it takes years and years for all this stuff to start happening. And if we make the right decisions now, we can turn things around. Okay, so let's talk about how we're going to turn things around for you. Now, there's a few medicines that all diabetics need to be on. And it seems like a lot of things, but I promise each thing has a specific purpose. And it's not like I'm just making this up about these medicines. This comes from specialists at Harvard and Stanford who do nothing but research and treat diabetics. And what I'm telling you is the most up-to-date information there is. Okay, the first medicine that we're going to talk about is a daily baby aspirin. So that's an 81 milligram aspirin. And the reason that you're going to be taking this is because aspirin is a blood thinner. The aspirin thins your blood out just enough to let those red blood cells slip through those tiny blood vessels in the back part of your brain and in your eyes, and it lets the blood keep flowing through those narrowed areas. So this medicine helps to prevent you from having a stroke or a heart attack. The next medicine that's important is a medicine called atorvastatin. This is a cholesterol-lowering medicine. Now, even if you don't have high cholesterol, you still need to be taking this. And let me explain. Cholesterol is the other thing besides sugar that clogs up blood vessels, so we're trying to do whatever we can to roto-rooter everything out so that the blood vessels keep blood flowing. The third medicine we're going to talk about is called losartan, and it's a blood pressure medicine. Now again, even if you don't have high blood pressure, you still need to be on this. And the reason is because this medicine helps to prevent the blood vessels that supply your kidneys from being damaged. So have you ever heard of people being on dialysis? Well, that's what happens to diabetics when they let their diabetes get out of control and their kidneys start failing. And this medicine has been shown to prevent that from happening. Again, I know this seems like a lot, but before we used all these medicines on people, they would just die of a stroke or a heart attack or kidney failure, and it's really not like that anymore. So now let's talk about the medicines that actually work to lower your sugar. There's a lot of great medicines out there these days, and I'm not going to go into detail about all those medicines because that's going to be an individualized talk that we'll have in person to figure out which medicine is right for you. Okay, we're going to switch gears now for a second. With the treatment of diabetes, it's really a team approach, and what I mean by that is I can help you with the medicines, but you have to do things at home to help yourself. And the first thing you need to do is completely change the way that you're eating, because right now, what you're doing is not cutting it. As a diabetic, you need to be eating foods that are high in protein and low in sugar. As you might expect, when you eat foods that are real high in sugar, there is more sugar in your bloodstream, and this makes all the stuff that we've just talked about worse. So let's talk about foods that are high in sugar. And those would be foods called carbohydrates. So stay with me here because this can be kind of tricky. So sometimes it's obvious when food is high in sugar and carbohydrates, so that would be things like candy and sweet tea. All that's pretty obvious. But there's some other foods that you might not guess that are actually turned into sugar once they get into your stomach and intestine. And those would be things like corn, breads, fruits, fruit juices like orange juice. Chips are the same way. Once you digest them, the thing that's left at the end is a sugar called glucose. On the other hand, foods that help to control your sugars would be things like proteins. These are things like meat, so like grilled chicken, steak, hamburger without the bun, fresh fish, walnuts, peanuts, things like that. Now, when it comes to following a diabetic diet correctly, there's really a lot to it, and there's a lot of nuance that I can't teach you in a 10-minute clinic visit. But if you want to remember one concept, though, try to remember this. If the food is white, you probably shouldn't eat it. So things like breads, rolls, potatoes, pasta, and chips. Okay, let's switch gears here. A word on exercise. Okay, remember our story about in diabetes, the sugar gets trapped inside your bloodstream and it can't get out, right? Well, there's one exception to this, and that's when you're exercising. Your muscle cells actually have this odd ability to suck up sugar from the bloodstream and burn it off as fuel, no matter how bad your diabetes gets. It's like they have these little special straws that can poke through the blood vessels and slurp up all the extra sugar when you need it when you're exercising. No other cells in your body can do this except for your muscle cells, and that's why it's so important to use this to your advantage. The more you exercise, the lower your blood sugar will be, and for a diabetic, exercise is as important as taking the medicine. But even if you can't jog or go to the gym or lift weights, just going for a walk after you eat or sitting on your couch and doing some arm curls with some light weights, anything that you can do to stimulate your muscles is going to help to pull that extra sugar out of your bloodstream and into your cells. Okay, we're on the home stretch, so just hang in there with me for a few more minutes and we're about to be done. When you have diabetes, it's important that you check your blood sugars each morning before you've had anything to eat or drink. We call this your fasting blood sugar. And the reason that it's important for you to check this and to keep a journal of all the days and all the blood sugars is because When I see you in clinic, I'm going to want to see that journal, and that's going to help me to adjust your medicines. Just to give you an idea, the goal for your blood sugars each morning is going to be between 70 and about 115, so anything in that range. And anything below 70 is actually too low, and you'll need to call me if you get numbers in the 60s or 50s. We'll discuss how to check your blood sugar in another video if you need more help on that. Okay, last thing. You're going to hear me talk about something called hemoglobin A1C, and this is something that we'll check either every 3 months or every 6 months, depending on how out of control your diabetes is. I want to take a second just to explain this, because it's something that I'll be talking about a lot, and I think you need to know what it means. So this is a neat lab because it kind of tells me what your sugars have been running for the past 3 months on average. And our goal is to keep this number below 7, which tells me that your morning sugars are running around 115 to 100. Okay, that's it. I hope you feel more comfortable with what diabetes is and what things can happen when you have diabetes and how the medicines help to treat you and prevent all those bad things from happening. Thanks for taking the time to watch this video.